All good. All right, everyone. Now in this topic, we will briefly discuss about skin and wound care. So as a nurse, one of our major responsibility is to help the patient to assess their skin condition and provide a very good skin care. Now, if some patients they have any kind of wound located in anywhere on the body, we have to provide a very professional wound care to prevent any kind of infection or deterioration. So because skin care and wound care is a very vital part of nursing job. So we will have a look about how to provide patient with a very good skin and wound support. So firstly, now when we have a new patient coming in, firstly we have to do a thorough skin assessment. Okay, skin assessment. Now skin assessment is mandatory for every new patient. Yeah, every new patient. So let's have a look at how to assess the skin condition. Now, we already understand like the skin layers, right? So we know that we have 3 skin layers: the epidermis, the very first layer, and then dermis, and then subcutaneous tissues. Yeah. Especially for elderly patients, older people. Now, because they're because of the age, so their skin loses elasticity and loses the structure. The skin becomes really fragile, easy to break, easy to lose the layers. Yeah, so older people, so especially if we have an older patient, we have to be really careful about their skin and do a very strict skin assessment. Okay, so when we assess skin, we have to have 2 nurses to assess patient together. Yeah, so for every new patient, a skin assessment must be conducted with 2 nurses. Okay, so 2 nurses skin assessment. So if you work as an enrolled nurse, you should assess the skin with a registered nurse like that. And then if there is any skin condition that you notice, you should report to your supervisor. Yeah, report to the RN. And then document on your progress note. Okay, document. Yeah. And if the patient has any kind of wound, if there's any skin lesion, a broken area on the skin, like any kind of wound or ulcer, that is newly found, you have to report to doctor to review. And also, in every hospital, we have a team called wound management team. So this wound management team has a lot of quite a few specialist nurses. So those nurses, they are specialized in wound care. So they have really deep knowledge about how to look after the wound. So if you notice any skin problems that you don't know how to deal with, make sure that you refer to wound management team to get the wound specialist nurses to come to review patient and give you more detailed instruction. So they know a lot about what kind of wound dressings to use. They give good education. Okay. So report to RN, report to doctor, report to wound specialist nurses if needed. Okay. Now, when you assess skin, you have to really tell the patient to expose all the skin areas. Okay, expose the whole body. Because some patients, they might feel embarrassed, so make sure that when you assess their skin, cover the curtain, protect patient's privacy. Protect patient's privacy. Don't let them to feel uncomfortable. But you have to examine every part of the skin. And when you assess, make sure you check if there is any broken skin, if there's any wound, like I mentioned, if there's any rash, if there is any pressure injury. We talk about pressure injury, right? Especially on the bottom, on those bony prominences area, the bony areas like elbow, bottom, like those areas. Check whether there's any pressure injury. And check the color of the skin. So normal skin color should be pink, isn't it?
Pink, yes.
So like check the color of the skin, see if there's any abnormalities, check if there's any discoloration, okay? And also, when you check the skin, make sure you check the skin turgor. Skin turgor. So what means skin turgor? That means when you pinch the skin, lift this little skin up, okay? Lift this forward, and then release your, for example, on the hand. So pinch a little bit skin, release it. It should go back very quickly. Okay, very quickly. If it doesn't go back, quickly, that is like poor skin turgor. Skin turgor. So if the skin looks very dry, and and the skin, the color, not normal, and also the skin turgor is poor. So when you lift it and when you put it back, it's gonna take longer time to return to the normal state. So that means the patient might be dehydrated, maybe the skin is too dry, or maybe because of patient's age, so they might lose elasticity on the skin, like that. And also check the skin texture, skin texture. So feel the skin, feel the skin. If it is more, check the moist, whether it's whether it has good humidity. So that means the skin should not be too dry or too wet. Okay. So when you touch the skin, you should feel warm, with normal temperature, and also normal color, and also like normal texture, right? And not too dry, like that. So if the skin is too dry, that means the patient could be also dehydrated. So assess like different parts of the skin condition. Now if you notice that the skin has any kind of issues, remember to document on the skin assessment form. So when we admit new patient, we have a skin assessment form to be filled. On the skin assessment form, we have all those areas to tick. Okay, so you need to assess every part of the skin condition. Now, next thing is we will talk about like some common skin conditions. Some common skin conditions. For example, especially for older patient, right? For older patient, a very common skin condition I just mentioned is called the pressure injury. Pressure injury. Pressure injury. So pressure injury is also called a bad sore or pressure sore. You can say pressure sore or pressure injury. So pressure injury, now from the name you know that this is like injury that happens on your bony prominences areas on the body. So when you assess the patient, check especially those bony areas. The bony areas means, like for example the elbow. Like the scapular, the shoulder blade. The hip. The lower back, like above the bottom area. That area, remember, that's called coccyx sacrum area. Coccyx sacrum area is located above your bottom and just at the lower back side. Lower back areas. So these areas, because they are quite bony, that contains more bone with less flesh. So it's very easy to get the pressure injury. So if the patient says sit in one position for too long or lying on back for like many hours, these areas like elbow or the bones, lower back or the heels, they're very easy to lose the skin layer and develop this sore or the injury. Understand? So this is called pressure injury. So those sore or injury happened over the bony areas on the body due to long time immobilization. So if the patient do not move for a long time, if the patient stay in one position for a long time, it will be easy to develop this pressure injury. Okay? Yeah. So pressure injury normally, pressure injury has 4 stages, right? So initially, once there's a pressure injury, initially the skin gonna look red. Yeah, red, but the skin initially is intact, but just red.
Okay.
But if you don't take any action, it will develop like deeper. So the skin start to break down and form like a little hole, like ulcer, and then ulcer can become deeper and deeper.
Oh, okay.
Yeah. So altogether, we have 4 stages of the pressure injury. Yeah, 4 stages. Yeah. So stage 1 is the skin is still intact but just red. The stage 2 is that skin start to break down, and stage 3 is go deeper, form an ulcer, and stage 4 is like go even deeper and become a large cavity, and then the muscle tendon will be exposed as well. It's quite deep.
Oh my God.
Yeah. So that's pressure injury. But later on, we're gonna have a whole lecture about pressure injury in more detail. Yeah. Also for older patients, especially, some another skin condition could be for example, a diabetic wound, a diabetic ulcer. Yeah, like that. For those patients who have diabetes, understand what is diabetes,
yes.
Right? So if the patient have diabetes, that means they don't have enough insulin to balance their sugar level in the blood.
Yeah.
So they have like higher sugar level. Yeah, higher sugar level in their blood. So if in their blood they have higher sugar level, it can damage the skin. Yeah, damage skin. So so normally patients have diabetes, they have like high chance of getting that ulcer.
Okay.
Yeah, on the lower legs especially.
Oh.
Yeah, on the lower legs. So this is called a diabetic ulcer, or on their feet. Yeah. Ulcer is like an erosion area. Like the skin the skin tissue get lost, so it form like a hole. Yeah. So some skin tissues get eroded. So and ulcer is a chronic condition. It lasts long. It cannot be quickly healed, right?
Okay.
Cannot be cured. So it takes long time to heal, and sometimes it never heals.
Okay.
So for patients with diabetes, especially, you have to be careful about diabetic ulcer. Check whether there's any ulcer on their legs and feet. Yeah. Other conditions could be sometimes patients have a skin lesion, and the germs like bacteria or virus could travel into the from the broken skin and then invade the skin tissue, right? Invade the internal tissue. So kind of infectious skin, skin diseases, some kind of skin problems caused by the infection, infection, especially the bacterial infection, caused by the bacterial. There's a very common bacteria. There's a very common bacteria that causes the skin problems. So this bacteria is called Staphy. Staphy. Staphylococcus. The short term is Staphy. Staphy is a very common bacteria that is located underneath the skin. Underneath the skin layer. So it's called a Staphylococcus aureus. So this bacteria is located in the skin. So it can, so most cases it doesn't trigger problem. It just stays in the skin. Okay. But if the patient is older in age and have poor immunity, this Staphylococcus can then invade and then cause harm. Have you heard about one skin condition called cellulitis? Cellulitis. I'll just. So cellulitis.
Cellulitis.
cellulitis. So cellulitis is a quite common skin problem among elderly patients. And cellulitis is caused by this bacterial, especially the staphylococcus. This bacterial travels through a broken area on the skin and then triggers a whole infection, the whole inflammation of the skin. It's like infection, infected, by the bacterial, especially the staphy. Staphy is a very common bacteria that stays in your skin that can cause trouble, right? Infected by this bacteria and then trigger the whole inflammation. Inflammation. So once patient has this cellulitis, what gonna look like? So cellulitis normally happens to the lower legs, So once patient have this skin condition, the legs gonna look very red and become swollen and quite painful as well. So red, swollen, quite painful, like this. The skin could, easily break down, and even there will, even the fluid could leak out from the skin. So that's cellulitis. So the patient, especially the leg, become very swollen, become enlarged in size. So this is quite common. This is a quite common condition among the older patients. It's infected by the bacteria. So now we just briefly talk about some common skin conditions, and there are some other common conditions. For example, if the patient is like allergic, the skin is allergic to something, they could develop like allergic reactions. For example, the dermatitis. Dermatitis, like, there's like inflammation happen on the skin triggered by some allergies. The skin could be allergic to something in the environment, and once those things get in contact with the skin become, like shows all these kind of problems like rashes, like redness, like all these problems. And then this is called dermatitis. There are different types of dermatitis as well. Sometimes, so say if your skin is allergic to something, if you get in touch with those things, your skin can quickly show up some rashes. So make sure that you ask patient what things you're allergic to, and then if the patient say I'm allergic to this, try to avoid these things. To protect the skin. So let's be a bit quick now, and then thirdly we're gonna talk about how to do the skin care. How to provide the skin care. Now every shift, because as a nurse we do morning shift, afternoon shift, like late shift, right? And then the night shift. So during every shift we should assess the skin, and we should help our patient to maintain a good moist on their skin. So for example, for those patients who have dry skin, what do you have to apply?
Apply some
moisturizer. Understand this word. Moisturizer. So moisturizer is like, for example, some lotions, creams that can hydrate the skin. So if you apply this moisturizer on the dry skin, it can hydrate it, make it increase humidity, make the skin make the skin not too dry, right?
Not too dry.
Reduce the dryness of the skin. So for patient with dry skin, if the skin is dry, apply like moisturizer, apply creams, to hydrate the skin. To make the skin big, increase the moist. If the skin is too dry, the skin is very easy to break down. If the skin is too dry. And also, normally you apply the cream after the shower. Normally you give the shower to the patient in the morning and night, right?
Yes.
So after the shower, you observe the whole skin and apply some like moisturizer to the dry areas. And also, if the patient has any wound, any like skin lesion or something, what you have to change the dressing, right? Apply dressing. Yeah, apply dressing.
Yeah.
Over the
wound.
Yeah, over the wound. Now, if there's a broken skin and there's a wound like ulcer or something, never leave the wound open. Okay? Yeah, don't leave the wound open. Okay. Apply a waterproof dressing. Apply a dressing over the wound to prevent the wound being infected by the germs in the environment. Okay, to prevent the contamination of the wound.
Yes. Okay.
So if you don't apply dressing, the wound will be exposed to the air and then it can be contaminated. Do you know this word? Contamination. Yeah. So prevent contamination. Contamination. Now, try to learn how to pronounce this word. Yeah. Contamination means the wound get dirty by something in the environment.
Okay.
Yeah. Say, tell the patient never touch their wound with a bare hand.
Okay.
Yeah. If they need to manage their wound, let them to perform hand hygiene, wash their hands first.
Yes.
Wear a glove, wear PPE.
Yeah.
Okay. So whenever you manage patient's wound to prevent contamination, so that means to prevent the wound from getting dirty, you have to apply gown, glove. Before you manage the wound. Okay. Yeah. Never ever touch the wound with the bare hand. Okay. Even you wear gloves. Even when you wear gloves, still don't directly touch the wound. You have to get a dressing pack. Okay. Get use forceps. Yeah. Use forceps to get a dressing and then apply on the wound. Don't directly use your hand to manage the wound.
Okay.
Yeah. Also now, if the patient has any skin issue, like I said, we need to document and report. Okay. Now, for patient who have like a diabetic ulcer or something like that, right? So make sure they always once you finish the dressing, once you dress the wound, you make sure they wear like comfortable socks, right?
Okay.
Yeah, shoes, comfortable shoes. Okay. Because if they wear too tight shoes, that can, give more pressure to the skin. Yeah. And that won't be good for the skin. Yeah. Okay. So make them wear comfortable clothes, comfortable shoes, comfortable socks. Yeah. To give the skin enough, space. Yeah. And anything else? Like with patient, if the patient has like pressure injury, okay, pressure back sore, like pressure sore, pressure injury, you have to make the patient exercise regularly. So because I said pressure injury is normally caused by long time immobilization. Immobilization means not moving. So you have to let the patient to move every 2 hours like that. So for patient who is like bad bone, reposition the patient at least every 2 hours. 2 hours to prevent any pressure injury. Okay. And you can also like put a cushion underneath the bottom, isn't it? If there's pressure injury, or use an air mattress. As well. Okay. So there are different ways to maintain healthy skin. Now, last thing I want to just mention is last thing I want to mention is say if the patient has a wound, we will need to regularly clean the wound, isn't it? We have to regularly clean the wound. So what cleaning solution we use to clean the wound in the hospital? Now this in here I want to introduce that one as well. So when the patient has a wound, the wound must be cleaned regularly. Okay, to prevent infection, right? So there's a very important solution we use to clean the wound in the hospital. So this solution is called normal saline.
No, yes.
Normal saline.
Yes.
Yeah,
saline,
normal
yes.
saline. So remember this
Yeah,
one.
yeah, okay.
Normal saline is also called sodium chloride. Sodium chloride. Yeah, sodium chloride, 0.9 percentage.
Okay.
Yeah. Sodium chloride,
Yeah.
0.9 percentage is also called normal saline. So this is the most common cleaning solution that we use to clean the wound, clean all kind of wound for the patient to prevent the growth of the germs.
Okay.
Yeah. So this solution is very effective in preventing infection because any broken skin could have a higher chance of getting infected. Yeah. So we will have to clean this broken area, like most times daily, every day we have to clean it and then dress it to prevent infection.
Yes.
Yeah?
Okay.
All good.
All good.
So I think in this video we just discussed about these things. So hopefully now you have just a general understanding about how to assess skin and what things to look, and then how to provide basic skin care. Is that clear?
Yes.
All good?
All good.
Thank you.